evening, ma'am. We're going to discuss a case of a woman with polycystic ovarian syndrome in a dental and medical perspective. So first, let me paint you a scenario like this, in which a patient, like this, like this pala, came into your office. So personal information of the patient, name, CCO, birthday, May 6, 1994, age 23 years old, gender, female, occupation, student, and address from Sampaloc, Manila. For the past medical history, the patient has complete immunization, has had eye surgery last 2008, was diagnosed of dengue last 2008 also. And for the family history, from the mother side has nasopharyngeal cancer, has breast cancer, and hypertension, and also asthma. For the father, has a history of diabetes. And so, for the personal and social history, little to moderate activity, and the patient drinks alcohol moderately. The patient has quit smoking for 7 months. And for the review of systems, the patient complains of tooth sensitivity. So through thorough intraoral and extraoral examination, we can come up with the patient's SOAP, which means subjective data, objective data, assessment, and plan. So for the patient's chief complaint, sensitive po yung ngipin ko sa likod, referring to tooth 4-6. And for the subjective data, 10 months prior to consultation, a patient noticed a discoloration on tooth 4-6. 5 months prior to consultation, the patient complains of sensitivity on the said tooth. And during the consultation, the patient also complained of sensitivity, but there is no pain. For the objective data, as you can see, dental caries on developmental grooves and pits of tooth 4-6. For the assessment, reversible pulpitis. And it is considered as class 1 caries. So for our diagnosis, reversible pulpitis, it is discomfort whenever cold, sweet is applied and goes away within a couple of seconds following the removal of the stimulus. So its etiology is exposed dentin, caries, or deep restoration. So for the treatment of reversible pulpitis, restoration is needed on the tooth. So for our first journal regarding reversible pulpitis, according to the journal published to 2013 by the American Association of Endodontics, they came up with a universal language for diagnosing pulpal and apical lesions for root canal therapy. So according to the journal, they defined reversible pulpitis as it is based upon a subjective and objective findings indicating that the inflammation should resolve and the pulp return to normal following appropriate management of etiology. Discomfort is experienced when a stimulus such as cold or sweet is applied and goes away within a couple of seconds following the removal of the stimulus. Typical etiologies may include dentin, exposed dentin, caries, or deep restoration. There are no significant radiographic changes in the periapical region of the suspect tooth, and the pain experience is not spontaneous. Following the management of the etiology, the tooth requires further evaluation to determine whether the reversible pulpitis has returned to a normal status. Although dentinal sensitivity per se is not an inflammation process, all of the symptoms of this entity mimic those of a reversible pulpitis. So for the plan, restoration of class 1 caries with amalgam. Okay. So for our second journal, Management of Class 1 and Class 2 amalgam restoration defects, 5-year results, by Javier Martin, Eduardo Fernandez, Juan Estay, Valeria Gordon, Ivar Mihor, Gustavo Moncada, from the Restorative Dentistry Department, Dental School, University of the Chile, published November 23, 2012. So nowadays, a lot of people are going to the dental office, which complains of their old restoration, which is amalgam. This journal is a 5-year prospective clinical trial which evaluated amalgam restorations with localized defects that are treated by means of repair or refurbishing. For this study, 160 Class 1 and Class 2 defective restorations were included, and restorations were assessed by 2 calibrated examiners according to modified U.S. Public Health Service criteria, which includes marginal adaptation, anatomic form, secondary caries, roughness of restoration. The study focused on the application of 2 minimally invasive treatments for localized restoration defects, and compared this with no treatment and total replacement as negative and positive controls, respectively. So restorations were assessed by 2 calibrated examiners. And then for the conclusion of the journal, at 5 years, recall was examined in 45 patients with 108 restorations. So these are 67.5% of the total patients. The results suggest that repair treatment is as effective as total replacement of restorations with localized defects, reducing biological cost of the patient and providing new tools to the clinician. So to sum up this journal, refinishing restoration is a useful treatment for localized anatomic form defects. So these are all from management.
I will be discussing about the medical part of our report. PCOS stands for Polycystic Ovarian Syndrome. It is a condition that affects a woman's hormone levels. PCOS is a syndrome that affects ovaries and ovulation. There are 3 main features. First would be cyst. From the word itself, polycystic, poly means many, so many cysts. Each follicle contains immature egg that never mature enough to trigger ovulation, that makes women harder to get pregnant. Women with PCOS lacking estrogen and progesterone, what they have is the second main feature, which is the higher levels of male hormones, such as androgens, that leads to the number 3 main feature, which is the irregular or skipped periods. For the personal information of the patient, named CCO, was born on May 6, 1994, 23 years of age, female, and is a student, and her religion is a Roman Catholic, from Sampaloc, Manila. For the past medical history, has a complete immunization, had an eye surgery, removal of style last 2008, also on the same year, had a dengue. For the family history, nasopharyngeal cancer for the mother, breast cancer, hypertension, and asthma. For the father's side, diabetes. Personal and social history. Little to moderate activity, drinks alcohol moderately, and has quit smoking for 7 months. Review of systems. Nearsightedness and tender breasts. For the general survey, the patient is coherent, conscious, ambulatory, and not in cardiorespiratory distress. Vital signs. Blood pressure is 90/80 mmHg, pulse rate of 86 bpm, respiratory rate of 17 bpm, and temperature 36.4 degrees Celsius. The height is 149 centimeters and weigh 57 kilograms. The body mass index is 25.57, and it shows that the patient is overweight. The chief complaint was, irregular po ang mens ko. For the subjective data, history of present illness, 6 months prior to consultation, irregular patterns of menstruation for about 6 months. 2 days prior to consultation, unusual discharge was found. On the day of the consultation, the patient is undergone ultrasound. For the objective data, clinical findings were, the signs are weight gain, facial hair, acne, male pattern baldness, darkening of the skin. For the assessment, upon the ultrasound, small ovarian cysts were found on her left and right ovaries, and the diagnosis was polycystic ovarian syndrome. For the plan, oral contraceptives. Oral contraceptives help regulate menstruation cycle and treats PCOS symptoms such as hair growth and acne. It is taken 1 pill per day and it should be on the same hour. The effects was tender breasts, mood swings, nausea, weight gain, sometimes weight loss. Next would be clomiphene. Clomiphene is a non-steroidal fertility drug that helps women to get pregnant. It causes the pituitary gland to release hormones needed to stimulate ovulation. And it is usually taken once daily for 5 days. On the 5th day of your men's cycle, after taking this, 5 to 10 days most likely the woman will ovulate. And to improve chances.
So for the correlation between polycystic ovarian syndrome and dentistry, did you know that PCOS can turn these healthy gums into this kind of gums? So for our last journal, periodontal status and high sensitivity C-reactive protein levels in polycystic ovary syndrome with and without treatment by Porval S, Dewari S, Sharma RK, Shinghal SR, Narula SC from the Department of Periodontics and Oral Implantology, Institute of Dental Science, Rohtak, Haryana, India, published March 4, 2014. So according to the study, periodontal status and high sensitivity C-reactive protein levels in polycystic ovary syndrome with and without medical treatment by Porval SS, Tiwari, Singhal, they concluded that women newly diagnosed with polycystic ovarian syndrome may have increased prevalence of periodontitis, with higher measures of periodontal inflammation and breakdown than those on medical treatment for PCOS and systematically healthy females. So this is due to the increased clinical attachment loss of the teeth, bleeding on probing, and increased HSCRP, which indicates signs or markers of inflammation on women newly diagnosed with polycystic ovarian syndrome, compared to the women of currently on treatment for PCOS. So to sum up everything, upon knowing this information about polycystic ovarian syndrome, we should always remind our patients to maintain good oral hygiene, to avoid not only caries, but also periodontal disease. So by doing so, our patients will surely appreciate our dental care. Thank you.